All right. Well, in the interest of time, we'll go ahead and get started. Good afternoon, everyone. My name is Desmond Banks. I'm a clinical assistant professor here at Boise State University, and I have the luxury of chairing our continuing education committee. And we're doing our first time doing this at Boise State University continuing education series, where we're really seeking to bridge the gap between the university and surrounding communities and stakeholders. And so this is our fourth uh, presentation within a series. We have two more coming up this spring. And without further ado, we're going to have our very own Dr. Toevs, who's going to be leading today's presentation along with other community partners on bridging systems, shifting components, changing patterns of interactions, and reframing mental models. So Dr. Toevs, I'll go ahead and hand it over to you.
Thank you, and welcome all, and thank you, Dr. Banks, for that setting the stage for us today to give some thought to our work in Idaho that we do around bridging systems. And as we think about bridging systems, we're focused on systems change, which requires shifting the supports of a bridge, that requires changing the patterns of how those supports might interact with each other, and reframing mental models for systems change. As I thought about bridging systems, and in light of Martin Luther King Jr.'s birthday and Human Rights Day yesterday, thinking about the opportunities we have, and really our charge, our call to action of we must continue to build bridges. We must continue to link partners and engage with partners and shift, again, shift components, change patterns of interactions, and reframe as we think about addressing the really intractable problems. And we think about income disparities in our country. We think about issues of housing. We think about issues of mental health and behavioral health. You know, those issues are not the purview of any one entity. And so it's this vision of a bridge of how do we bring the partners, the resources together to maximize this opportunity to address problems within the context of, again, that larger system and I think some of our country values, the U.S. values of human rights, human dignity, and freedom to live a healthy life. I am delighted today with, oops, are my slides not changing? Oh dear, sorry about that. I'm pushing the wrong button for the slides. Do you see a bridge now? Oh. Oh, you gotta love it. How many years do we get to do virtual sessions and you're still missing a button? So here is the beautiful friendship bridge. Again, thinking about this session of bridging systems, bridging opportunities to shift the context and create sustainable systems change. So I am joined today by a panel of systems change experts, I want to call them. And I'm really thankful that we have such robust partnerships throughout the state of Idaho and that are working within this area. Our agenda, I'm going to spend a few minutes talking about systems change in general, and then each of our guests will share just a little bit about the work that they have been doing within this arena of systems change, which again is focused on changing partnerships, evolving mental models that we hold around populations that may be underserved and underrepresented. So I have Katie Lemansky, and each of our presenters will also introduce themselves, but we're also joined by Courtney Kelly, who is representing the Western Idaho Community Health Collaborative, Kelly Battersheim, who is joining us from Valley Regional Transit, and Charlene Carrio, who is joining us from Southwest District Health Department, and she leads their community health programs, and specifically the work that they've been doing in rural communities around their community health action teams. So delighted to have this group in the room to share the vision and I think hopefully to give us inspiration for how we keep moving forward in Idaho around our systems change initiatives. So before we kick off, we have a pre-session poll we are going to ask you to participate in. And this poll will also ask you to, depending on your response, might ask you to provide a response in the chat as well. So wanting to get to know the people in the room here. And I'm hoping you're seeing the poll. And Dr. Banks, if you could monitor the chat for us, that would be really helpful.
Absolutely, Dr. Toevs, absolutely.
Actually, thinking of the population distribution in Idaho, our representation is not too bad, as it reflects the primary location for folks residing in Idaho, but glad to have welcome to those from Northern Idaho, Magic Valley, Southeast Idaho. That is great to have you on this, join us for this session. Our second question is, do you know of any community-led multi-sector activities underway in your community? And delighted to see that some are, most are not, and would love to hear, Dr. Banks, if you've got the chat open, if you could shout out for those that responded yes, if folks have given some ideas of what those multi-sector activities are in their community.
Had to unmute myself. Absolutely. We have Miss Dana Teixeira, the YMCA and United Way in state of Idaho Rural Health. We also have Mr. and Mrs. Bauer. I can't see the first name there. Many apologies. Magic Valley Center for Community Health. We also got a Build Health Challenge initiative out of Payette. We also have our Build program here by different names. So glad to see that from Miss Strauber. ARP from Ms. Sword, ARP's efforts to build up age-friendly communities in various towns across Idaho. So we a variety of initiatives, Dr. Toevs. Absolutely.
Thank you.
And the Lake Comer, we have Miss Lynn, libraries, telehealth initiatives, and Learn Tech training.
Great examples of the work that's going on across the state in, I think, both urban and rural communities. And then our last question on our check-in poll is, are you currently engaged in any multi-sector projects? And we have opportunity there for growth and expansion. About 50% in the room indicating they aren't currently involved, but certainly, again, some are, and I'm guessing that 33% that's there may represent some of what we saw, some who responded from that initial chat or the previous question. And again, I think as this check-in poll, what we were hoping to gain from this is certainly to understand here who's in the room, and to also capitalize on knowledge that's here, but also extend that knowledge as well. So I am going to share the results of this, and I guess I should have been doing that earlier. Sorry about that. So where do you live? Again, most of the folks in the room are from Treasure Valley, but this is a nice distribution of where the population is. Not sure if they know of multi-sector, but certainly some in the room that has some expertise. And as Desmond shared with us, those are great representations of community multi-sector partnerships. And again, opportunities to grow, and how do we expand the number of individuals engaged in this type of work? So before we get to our guests and the presentations that we will talk about our own work that we're doing is, what's the why behind bridging systems? What's the why behind the work we do? And we're not really sure who this quote is attributed to, but I think it works for the why for me is, we've been doing things in, and I don't really like the term siloed, but we've been doing things in sectors and over for many, many years, but we aren't really getting the results we need, particularly when we're talking about deeply rooted issues like housing, income insecurity, behavioral health, mental health. And it's incumbent upon us in public health, in whatever role that you're serving, is that we really think strategically about, we can no longer afford to keep doing things the way we have because we're not accomplishing our desired outcomes. One of my favorite resources that I use in thinking about systems change is the Waters of System Change, which is put together by the FSG organization. And I'm guessing that many of you are familiar with this work. But it's talking, this vision of systems change breaks it down into levels of impact. I think within our worlds, within your own families, we do a lot of work around policies, changing the practices, and also resource flows. So I think all of us are quite familiar with this, the explicit work that's done around changing either within systems or between systems. What this system or vision of change, though, begins to call out is what else needs to happen. We can change a policy, but if we don't work on changing the structure of the bridge by connecting and building relationships, and also changing the power dynamics that bridge is based upon, it's unlikely that we have implemented sustainable change, and it doesn't accomplish the systems change, that underlying work that we need to do to address really difficult challenges. And then the deeper level of systems change that I think we're all actively involved in our current world is the transformational change that is changing mental models. An example of the mental model that was embedded in many of our minds from years under the Reagan administration was, the welfare mom, the woman with the, manicured hands and nails and driving around in a Cadillac. That mental model of the individual that needs support, foundational, basic supports to meet the needs of the family, is one of those mental models that has been very, very sticky. And I think as we in public health and in the work that we do, we have to recognize that individuals come to the table with their mental model. And that is the work in terms of systems change that we need to continue to press upon. How do we not only change policies, workflows, relationships, but how do we identify and then work to inform and change those mental models? And again, I think that's having the group of experts in the room that are going to visit with you about some of their systems change work really, I think, gets to providing us with some examples of how within that work they are striving to accomplish, chip away at change from all three of these structural levels that must be part of sustainable systems change. Another visual that is often used in talking about systems change is this iceberg model. Is that we see the evidence of a problem, of a challenge, but that's not, to address that is important to recognize it, but it requires going beneath the tip of that iceberg to look at patterns of behavior. And I think, again, as we think of working in public health, that importance of looking at data and thinking about the AARP work that they are doing with age-friendly communities. They are going to communities and gathering information from community members to identify patterns, identify needs across populations, and then stepping in to make systems changes through the community. And I think because of that work, then also striving to impact the mental model that communities may have about older adults in their community. The value, the economic value of an older adult brings to the community, the cultural value of intergenerational populations. But as we think about our work in systems change and we hone our skills to recognize that there is multiple levels, and the leverage, the stickiness of our issues are greatly enhanced if we must continue to push on getting beneath the iceberg and changing structural systems as well as the mental model. So again, in systems change, we have these visuals of levels of leverage, but for me, it really comes down to these three pieces of thinking about how do we work together to shift components, and that's bridging systems, changing patterns of interactions, that's that power dynamic, it's the interrelationships, and then identifying and working to reframe mental models that people may come to the table with as we address challenges and opportunities. So one of the projects that we've been working on through the Center for the Study of Aging is this multi-sector plan for ages. And this is an initiative that represents what is trying to happen within systems change. And it's looking at these multi-sector connections. And we're thinking about livability for all ages across our state. And so a multi-sector plan is really this ability to bring individuals together in the same room and build this out. In Idaho, we have made several presentations to the governor's office. We haven't stuck there yet. We are still working at this. Other states are further ahead in what they're doing with system changes around a multi-sector plan for all ages. And as you know, at first I was frustrated. I was thinking, gosh, when is Idaho going to step up and really become a leader in this systems change? Because what this model, the multi-sector plan for aging, is based on is that it leads out of the governor's office. All of these states that have gone forward have based their initiatives out of a call from the governor's office. And so I was thinking, gosh, I'll just throw my hands up and say, well, this isn't the right time. We can't push it. And then I started thinking about the work that's doing in our community and recognizing, well, you know, we may do this differently here in Idaho. Systems change in Idaho may come from grassroots, grass tops, community-based efforts. And that's how we move multi-sector plans for all ages in Idaho. So we flipped the model, which isn't that unusual, I think, in Idaho. I think we, as systems change agents, we've got to be continually thinking about who's at the table, where are our strengths. And with that, I'm going to turn the time over to Katie Lemansky with the Get Healthy Idaho program. You should have access to share the screen, Katie. And because I think the Get Healthy Idaho work is one of those amazing examples of systems change.
Awesome. Thank you, Sarah, so much for the opportunity to share. Just a quick double check. You can see my screen. Okay, awesome. Good thumbs up. All right. Well, thank you again for the invitation. I'm very excited. I think that was the perfect tee off to myself and partners and our presentations today. So very excited to talk about Get Healthy Idaho. I'll try and be brief, but it's hard to be brief about things you're passionate about. So do the best I can. But I'm going to talk a little bit about how we got here, what we're building, how we're really focusing on transformational change and how we invest at the public level into communities and invest in and with communities at the local level. And there we go. All right, so this slide really is just a quick timeline of events. So Get Healthy Idaho is born out of our 2019 5-year statewide health assessment. You see that was done last in 2019. We are now in the midst of getting our 2025 statewide health assessment and plan, our 2024, plan put together. So looking at the outcome of this statewide health assessment, our stakeholder meeting, and the input that we garnered from cross-sector stakeholders across the state. We really looked at the top priorities. What were they? And at the time, the partner group and based on our data really landed on these 4 main health priorities. So we then take those priorities into our statewide health improvement plan and form actions and strategies that can really help improve on the measures within those major priorities. At the same time, we were working on internally on sort of what we've been saying for 5 years, building our plane as we've been flying it. I hope that we have built a good plane at this point in our process, but focusing on this President's Challenge that came from ASTO, which is our national peer kind of advocacy organization, that Association for State and Territorial Health Officials. The challenge at the time was to build healthy and resilient communities. And that really was taken to heart by our state health official, Elke Shaw-Tulloch. She's our division administrator here in public health. I did not introduce myself, so my apologies. I do work in the Division of Public Health for the Idaho Department of Health and Welfare. Have been here for almost 16 years, and there you go. There's my quick intro. So we took on this President's Challenge really to heart. And so in late 2019 and 2020, really started building, what does the strategy for Get Healthy Idaho look like? How do we build healthier, more resilient communities in Idaho, knowing that that's going to take a solid commitment of shifting investments, the way that, as Sarah mentioned, siloed funding, shifting those investments into more of a braided approach where we can invest in community-led, place-based efforts to improve health equity. So we really embraced this challenge and created Get Healthy Idaho. So quick little vision, mission statements. We focus on healthy people, and our vision is help healthy people living and thriving in safe, healthy, and resilient communities. And our mission is to create the conditions that ensure all people can achieve optimal health and resiliency. Okay, so you can see our strategy here. Again, it's a very focused on place-based, community-led model. And this strategy is formed around these 3 main pillars. So using data as our foundation to both inform and identify where are the needs, who is experiencing disparities, what approaches will have a positive impact. And we don't look at necessarily the literature, we're looking to community to help define that answer because it's going to be different. The needs are different and those solutions and approaches are different in every community. We also stay abreast of the trends and issues based on the data, the voices of the communities to help us cultivate collaborative relationships with our partners and in our funding communities. So it really puts the trust in the community as the experts for what is needed and what will work. And that helps to empower them to both design and to lead health improvements. And then the last piece is invest. We invest not only funding in programs or projects, but we also fund resources and time in the people within the communities that we fund, and across partners as well, but to really build their collective capacity, their knowledge, and their skills to scale their efforts and sustain momentum. So all of this work is an effort to layer local solutions. You might be familiar with this STREAM, social determinants of health and social needs, moving upstream visual. It's been around for quite a while now, but this is really our goal, is how can we get everyone in the stream rowing their boats in the same direction, preferably upstream, so that we can be more impactful and more effective in addressing those root causes of poor health downstream. We utilize a braided funding model. So this was the first time we've had a lot of examples or efforts in the past where programs might partner with another program, or they might pool funds to achieve a greater aim. This is the first time that the Division of Public Health and really the greater department, because we do have funds from across the department, this is the first time that we've really put this much funding into a single effort. And the benefit of having a braided funding effort is that it allows for greater flexibility. So for our partners, rather than having one grant or sub-grant from each of these different federal funding sources, we pull them together and issue one grant to the community. So they are responsible for what their needs are on the ground and really moving that needle within their community based on what the community says their needs are. We take all of the accountability to these grantors on our side so that the community can focus on what they need to focus on and not get caught up in the bureaucracy of government funding. So we are really lucky that we use this braided funding model. None of this work would be possible without this deep commitment from a deeply committed group of funders within the department that embrace our mission. You can see we've got 8 different funding sources here. We started with 4 in 2020. We now have 8. So the momentum is only growing, and it's really exciting to see. The support within, so the Division of Behavioral Health, you can see, is our sister division here. And so we utilize funds from both Division of Public Health and Behavioral Health. And our model is community-led. So we focus on funding community collaboratives over a 4-year period of time. So oftentimes in public health, we will issue a single-year subgrant. And then if the work is going well, we'll continue to reissue those year after year. And in this model, we focus our investment in one community with one organization and their partners over a 4-year period of time, because we know change can't happen and be impactful in a single year. It takes a phased-in approach. So you can see our phases here, really focusing with a community health assessment. So pulling that community together, whether there's an assessment that's already been done that they can add to or utilize those data, and then talk to the voices of the community, understand what the needs and the barriers are, and then identify a vision for health and well-being. Partnership or collaborative building is crucial element from the very beginning, and that ensures the sustainability and the scale up of the interventions they select. And then our action plan. So the kind of milestone or the output of year 1 is the development of an action plan. And these are directly informed by those community needs, and then they implement them in years 2, 3, and 4. And then that longer term investment is really critical because it helps to build, establish and sustain momentum. Once our 4-year investment ends, we're really working with communities to identify how else can you bring in additional funding and leverage either local, statewide, national opportunities to help sustain this momentum. Our Get Healthy Idaho communities have expanded in the last just 4 months. We started with our first 2 communities, Elmore and Bannock counties. And as of September 1st, we now have 3 communities, and we're very excited to bring on the North Central Idaho communities of Orofino and Kamiah. Elmore County was our first community funded early in 2021. That's led by the Western Idaho Community Health Collaborative. They are now in their 4th and final year. They'll end their work September of this year. So can't believe it's been that long already, but they're doing amazing work supporting disadvantaged individuals that are seeking health services. And I know Courtney is on the phone, so I'm not going to go dive too much into a lot of that work if she's going to talk about that. Bannock County being led by the Southeast Idaho United Way. They are now in the beginning of their 3rd year, so they still have 2 years of funding, doing an incredible work, an incredible project with Ride United, helping get people to where they need to be in the community to seek health services. And then we just brought on Orofino and Kamiah, and that's being led by a totally different type of organization. It's the Clearwater Economic Development Association based in North Central Idaho. So very excited.
And Katie, I hate to interrupt, but I'm hoping this is your final slide. Oh, perfect. You're perfect. You're right on. Thank you.
Yep.
And as you've set the stage for Courtney to share an intro, a bit about the work that WHC, which is the first initiative out of Elmore County that was funded through this braided initiative that Get Healthy Idaho stood up. So Courtney, I'll let you go ahead and share your screen.
Perfect. Well, thank you for having me today. And while I won't talk specifically about Get Healthy Idaho, we're really happy to be involved in that sort of community-based work. It's been super impactful in that community. Today, I'm here to talk to you all about the Western Idaho Community Health Collaborative and the work that we're doing currently with our implementation plan. Can everyone see my screen okay before I continue? Perfect. So the Western Idaho Community Health Collaborative, or WICHC, which is the acronym I'll refer to it as, is a multi-sector private-public partnership which was established in 2019. It covers this 10-county region that's here up on the map, with the green counties being part of Central District Health region, and then the orange counties being a part of Southwest District Health region. There are 23 members of WICHC that represent all different types of sectors and are all working together to transform the health of our communities by collaborating and prioritizing and collectively supporting community health needs that will transform healthcare systems, health systems, and then lowering the cost of healthcare ultimately. And we're also working to address the social influencers or determinants of health. So those social factors that are outside of the clinic walls that affect your health. This region also covers almost 48% of Idaho's population. So large percentage of folks are included in WICHC's borders. One of the important things that WICHC wanted to do was accomplish a collaborative CHNA or community health needs assessment. So this was published in 2023. It is the first ever regional assessment that covers the 48% of Idaho's population and then 2 counties in Eastern Oregon. So this is really exciting because all the organizations that are involved in WICHC are now operating under the same set of data and are on the same timeline for the projects they'd like to accomplish, which has never been done before and hasn't been done for our region. Something that we're really proud of about this data collection process is that the focus groups and interviews were done in every single county of the region, which just shows our commitment to reaching those like hard to get voices in rural communities and is a lot more robust and representative of the people that we serve. The results of the CHNA, or the top 3 health priorities, are number 1 is housing, or unaffordable, unattainable, and homelessness, housing and homelessness. The second one is behavioral health, and the third is access to adequate healthcare, including an emphasis on like vision care and the other specialty care. So with the results of the CHNA, the document is almost 150 pages long, so a little inaccessible to folks if they aren't super versed in public health. And we wanted to make sure that this data could be, easily understood by the average person who maybe wanted to see about the health in their community. So, WICHC secured funding for the Idaho-Oregon Community Health Atlas, which is really fun to play around in if you're a data nerd like me, but also for someone who isn't super versed in the data is really easy to understand. And it includes all the data from this 2023 CHNA, but a number of other sources, national data as well, are included in the Atlas. When I'm done, I will put a link to the Atlas and a few other things that I've talked about, so you'll be able to explore around in there. So now that we have the data from the CHNA, what do we do about it? What are the actions that we're going to take to address those needs? And traditionally, something called a CHIP, or Community Health Improvement Plan, is developed. So planning for how all of our partners are going to work towards addressing those 3 top health needs in our region. So the Regional Health Implementation Plan is just published last November 2023, and guides or lays out how all of WICHC's partners will be working towards those health needs over the next 3 years. So we convened WICHC members and completed an asset maps of regional gaps and successes, and there were 2 workshops that refine some of the strategies that were going to be undertaken. There's one-on-one interviews with WICHC members to further refine, and then we developed a draft and then published the final report, as you see here. So this report has 3 sections which detail the plan process and how it was developed in more in depth than I just explained. And then it shows like our framework. So yeah, how we came up with these different strategies. And then this document is intended to be a living document. So as actions are undertaken or accomplished, the tables will adjust accordingly. And I believe that is it for me. Let me stop sharing, and then I'll put a link to our link tree in the chat, which has links to the CHNA, the implementation plan, and then the WishC website, and a number of other things that help contextualize some of the actions that we're undertaking.
Thank you, Courtney, and thank you for stepping in at the last minute today too to fill Alexis's shoes. Nicely done. And I think that sets us up for getting to hear from Kelly out of the transportation arena. I'm just delighted that she was able to join us and really represent this multi-sector work that we do within public health, and how transportation is really key to bridging. Kelly.
Thanks, Sarah. I appreciate you inviting me to be part of this group. This was really one of the last projects I got to work on at Valley Regional Transit. And I should let everyone know, I worked on the planning side of it. It just got implemented this year, but I have not been involved in the implementation. So I'm going to frame my comments today really focused on this idea of bridging systems in the context of mobility and access. And we've been doing these same kinds of systems work with multiple partners across a lot of different transportation needs, but I'll specifically today, if I get can you see my slides? I assume. See if I can get them to advance. Let me try this. Oh, there we go. So I'm going to specifically speak about our Beyond Access in the Treasure Valley. And I've identified the Treasure Valley because that is the service area for Valley Regional Transit. This is a qualifications-based service that's specific for older adults and persons with disabilities. I think the idea over time would be that this would expand to other populations as well. It serves Ada and Canyon counties in the urban, suburban, and rural areas. So this really did expand access also into new areas. It consolidated a variety of services that were already being provided, and sort of as a service provider came about, they became part of a coordinated service, but this is now a consolidated system that's a little more efficient to operate. There's no charge to passengers, and it is also funded through braided federal and local funding, and powered by a scheduling and dispatching technology that's specific to public transportation. It's basically an Uber style dispatching system, scheduling and dispatching system, and really can be a proof of concept for other communities, other areas, and because it's very adaptable and replicable. So a little bit about the community partners. Of course, Valley Regional Transit was the project lead. We worked really closely with the Area Agency on Aging here in our district, in District 3. They had completed a strategic plan and have been a partner with Valley Regional Transit, and really open to trying new things and being innovative in the way that they work with us and as a partner. That I think led to this partnership that allowed for this service to be expanded. We also have a regional advisory council, representatives from the target market, both older adults and persons with disabilities, our regional transportation providers, local governments, ITD, the State Office on Aging, and Public Health and Healthcare. And all these partners came to the table for different reasons and to achieve the same result, but for different interests. And we used what's called a human-centered design, which is this idea of putting the customer first And so often in public transportation, when I first started, it was about how big is the bus? How often does it go by the stop? And those types of services are great, and we need more of that in Idaho, but they don't always serve the needs, the unique needs of vulnerable populations or populations with special needs. So, oops, I'm going the wrong way. Let me try this. Okay, so the guiding framework around this, I mentioned the human-centered design. That's sort of at the heart of it. And that was the thing that was different than the way we did business before in this space. What's really important in this, as you think about working across multi-sectors, is that you have to have a collective definition of the challenge you're trying to solve and the barriers and opportunities. So this framework really starts with that. What is the challenge we're trying to accomplish or overcome? And then you want to also align in a common future vision, so that if you've got 5, 10 different organizations all working toward a different vision, it can get very difficult and clunky. You also want to engage communities across multiple sectors, determine the desired results and the common measures. And I think, Sarah, you brought up the results, that's one of the things you have to have in systems change, is a way of defining those results. And then really the rest of it is around the idea of brainstorming, designing, and implementing that desirable, viable and feasible solutions. So when we think about the challenges, and anybody who's ever done multi-sector work and collaboration can really relate to this, you start in this place of uncertainty, and this process really has everyone involved looking for patterns and insights. You go to where the customer is, you go to where the partners are, and you try to make sense of all of this, and it can feel very uncomfortable. The person who trained me on this type of thinking really says you put people in a state of discomfort for longer than they would like. And you work through these issues as you go along. And then all of a sudden, I mean, it seems like all of a sudden, but sometimes it's months and weeks and years, it's all of a sudden the clarity and focus bring everybody to a single solution. And then this is really the graphic that shows what we're trying to accomplish, which is customer desirability, operational feasibility, and financial viability. So when those things all come together, then you are in that solution sweet spot. So what came out of this as I was reflecting on lessons and insights, and the Beyond Access was one of many of these design thinking projects we did around mobility and access, but really accepting and acknowledging that it's a very iterative and dynamic process. Sometimes you're taking what seems like little, turtle steps versus the hare steps. You have to communicate openly and often, and really meet partners where they are, and not and make sure that they're invested and active in the process. Managing expectations that some of these types of projects are very small scale, and they're not going to solve, world hunger, or they're not going to be big transportation systems. Sometimes they're just small, serving a particular population. So you also have to manage expectations for the types of results that you might see. That this was one of the biggest ones. Time is a limited resource. So sometimes it's being able to keep things moving, but also not acknowledge that people have a hard time making time for this. So it's just always kind of a tricky dance to work through those limitations, but also keep the projects moving. Funding elements are easier when you can define and measure the value for partners. So we really started with that. Why would partners want to be part of this? I always encouraged our staff to not, we've flipped the system upside down a little bit, because what we used to do is say, who's got the money, and then design the system. This way, you're actually designing the system. And it's interesting how easy the money piece comes together, because once people realize the value proposition, you're no longer dragging them to the table. They are eager to step up to the table because they figured out that in many ways it costs more not to do some of these services. When you're looking at health outcomes, when you're looking at for the Area Agency on Aging, isolation is one of the issues that they're trying to overcome. So this really hits their strategic areas in lots of different ways. And then the last thing is really being patient and adaptable as needed. Oops, go this way. So here's my contact information. We are doing a similar project in District 4 right now, and anyone that's interested in learning more about this process, it really is very simple. I wish I could make it sound like it's very complicated and it, you know, I'm the only one in the world that can do it. It's actually very simple. Part of the reason that I have been so excited about it is any community, anybody could set this up and do this without needing any kind of really special training. And with that, I will.
Kelly, you knocked it out of the park. Really appreciate you sharing those insights and lessons learned. I think one of the things just to call out about this work is this was shifting funding streams that organizations were very used to having. So I think you're pointing out this value proposition and representing that in data and outcomes from the user end was a key piece of how you brought people to the table to braid, to be willing to collaborate for the greater good.
Right.
And so thank you for that. And I think your notion of this outreach to rural sets the stage for our next presenter, Charlene Cario, who was with Southwest District Health and the work that she's been doing within communities in that Southwest region. Charlene.
Thank you. And I'm the last one with the screen share. Is it presenter view or regular? It's good. Perfect. All right. Well, hi, everyone. I'm Charlene Cario, and I get to lead our community health team over at Southwest District Health. So for those of you who are not familiar with the public health model or districts here in Idaho, Southwest District Health is one of the 7 regional public health districts. And if you've seen one public health district, you've seen one public health district. So all of them kind of operate a little differently. We all have unique communities that we get to serve. So this is some of the ways that Southwest District Health is really engaging with those communities that are part of our region. So I'm going to specifically talk about one of our initiatives that we call CHATs, so Community Health Action Teams. So we'll talk about how we approach community health action teams, what they're working on, the model they use, and some of the impacts that they've had. And then we'll wrap up with some tips on Charlene's tips for multi-sector partnerships. So you might be thinking, what is a community health action team? So it is not overly complicated. For us, they are geographically based health coalitions. So some of them are county-wide, some of them are specific communities. These chats meet routinely to identify health needs and opportunities within the communities that they serve. And the focus is to engage in community-led health conversations that then lead into action to address those identified health needs. Their membership is diverse. Every community has a kind of slightly different makeup, but I'll talk about some of those key partners in a few slides. But this is an initiative that's been a priority for Southwest District Health for the last 8 or so years. These community health action teams are facilitated or co-facilitated by Southwest District Health. They're a priority of our organization. So we, like everyone in public health or in public service, we have limited resources, but we have prioritized community voice by allocating some of our limited resources specifically to these community health action teams. So we've really put our money where our mouth is with engaging those regions and communities that we specifically serve. So I mentioned that we follow a model. So you've heard kind of glimpses of this throughout the Get Healthy Idaho and the Witch Tea discussion, but we follow a collective impact model. So each of our chats are really convening partners around this common agenda. We're kind of all there for the same reason. We know why we're there. We've got that shared vision. We're measuring our progress and we're measuring success kind of through this singular way. So whatever those priorities are, we're kind of measuring our work towards meeting those goals in a universal way. Folks who are at the table are supporting the work and the priorities of their own organization along with the chat. So there's this kind of mutually reinforcing relationship. There's continuous communication. So we've got some of our chat leads on the call today, and they can tell you how often they're communicating with each of their community partners, but it's throughout the month. So it's kind of when there's things popping up, there's that bi-directional, keeping everyone in the loop communication. And then there's a backbone organization. So for all of the presentations so far, it seemed like, wow, their work is just so seamless. People show up and things happen. Well, things happen because there's someone or something that's dedicated to making sure that that work progresses. And that's that backbone organization. So Southwest District Health serves as that backbone organization to each of these 6 community health action teams. So those kind of 5 components are that collective impact model, really in a nutshell. So if you're not familiar with Southwest District Health, we cover kind of the southwest-ish corner of the state. So we have 6 counties that we serve. So Adams, Gem, Washington, Owyhee, Payette, and Canyon counties. And this is a very geographically diverse area. So if you've been to the sand dunes in Owyhee County, they look very different than Council and New Meadows up in the mountain. And again, very different from Nampa. So lots of variety within the communities that we serve. But again, following this model, listening to community voice, engaging partners, we're really able to get at some of those unique or not so unique health needs across our region. So through this chat model, each action team has identified health priorities. And you'll see that while there are some differences, there's a lot of similarities. So some health coalitions and chats have, 5 or 6 health priorities. Some are really leaning in to 1 or 2. And they're slightly different. So even if housing is a health priority in Adams County, that's going to look really different than housing in Canyon County, or behavioral health in Owyhee County is different than supporting youth mental health in Washington County. So while the priority topics may be similar, the root cause or the action or the next steps kind of look slightly different based on each of the communities that we get to work in. And we identified these health priorities through listening to community voice, asking powerful questions, having those conversations about when we say this, what does this really mean? And I mentioned that the chats have been around for a few years. And what was really reaffirming is the chats really played a critical role in the WHC Community Health Needs Assessment that was published last year. And what was reinforcing was many of the health priorities identified in each of these chats were then identified as regional health priorities in that community health needs assessment. So for both WHC and Southwest District Health, this kind of community engaged model really gets to that same level of data. We're able to triangulate that information and really recognize, yeah, when our communities are saying that we want to focus on mental and behavioral health, that's reflected in the data and across all of our communities as well, even if it takes a slightly different leaning in each area. Now, knowing that this presentation was originally had an older adult focus, I did want to highlight some specific chat efforts that are impacting our older adults. So 3 of our 6 communities have priority areas specifically focusing on supporting older adults. So whether that's increasing awareness and utilization of existing resources, engaging in community events to combat loneliness, or specifically in Canyon County, the Caldwell Farmers Market and the Caldwell Health Coalition have created this really amazing initiative through the Senior Produce Program. They've engaged a handful of different vendors that also turned into funding partnerships. And now older adults accessing the Caldwell Farmers Market every Tuesday throughout like May through September. Participants at the market are able to get Senior Produce Program vouchers that allow them to access fresh fruits and veggies. They get an $8 coupon each week that allows them to kind of get those fresh veggies to take home with them. So addressing food insecurity among older adults through this senior produce program is one of those key initiatives of the Caldwell Health Coalition. So I am blazing through this, but I do want to highlight kind of who's involved in these chats. So we know that this work does not happen alone. Throughout each of the chats, there's a smattering of different types of partners, but I would say universally, we've got some healthcare engagement. We have education, whether that's, the high school counselor or the superintendent. We have law enforcement and other first responders. We have city officials. So it's great to see it when the mayors show up to these community health action teams. We know that like policy change is one way to really create healthy communities. We've got transportation and recreation districts, libraries. And while there are many partners who are showing up to these chats in their kind of professional role, they're also community members. So we ask that our participants really balance this like organizational expertise, but also like they live, work, and play in these communities as well. So making sure that they do fully represent that community member perspective when they show up to these conversations as well. So I do want to share some just general tips for generating these partnerships. It is beyond important to really understand the community needs. So what is it that you're talking about? What is the priority? What might this look like? And you can do that through informal ways, having conversations, really having a brainstorm. You can do it through more formal and structured ways, like a community health needs assessment. I would encourage you to, once you understand those needs, don't do it alone. Make sure you're engaging lots of different folks in those conversations. And you do that through strategic, but also serendipitous partnerships. So know who you want at the table. If you're focused on increasing access to physical activity opportunities, include the rec district, but don't forget about your faith communities as well. So make sure you have this really diverse membership, because that's where the best ideas really come out. I would encourage everyone to have a plan, but also trust the process. So Kelly's graphic of that like squiggle that eventually kind of like smooths out into a single line, you're going to spend a lot of time in that squiggle. But if you trust the process and be patient, you'll eventually get into some consistency and things will smooth out. So also be patient. And I would always encourage folks to have a framework to guide that process. So here at Southwest District Health and also with WICHC, we follow the collective impact framework. And that really kind of gives us some common terminology to guide our work and our process moving forward. So that is a very high level overview of some of the work happening here at Southwest District Health. So if you live in our area and you want to get involved in any of our community health action teams, please reach out to me or our general email. And if you have any just general questions, you can always reach out to me that way as well. But thank you. Thank you.
Charlene, thank you for that very dynamic and full overview of the work that you are doing. A special call out to, if we have students in the room or faculty in the room, I want to let you know that all of these partners have been most welcoming to engaging students in their work and really providing, I think, that budding public health professional with the opportunity to live public health. It's not all just in a bureaucracy. There is a tremendous amount of community engagement, and that's what makes this float. So really appreciate the perspectives each of you had provided. We do have one more poll. If we could just take, I know we're right at time here, but it's a short poll. Let's see if I can get to the next, let's see here. We'll see if the technology can work for us. Let's see. Oh, great. Here we go. Our post survey. We're trying to gather data as we go with all of this work. But just two questions. Now that you've heard our stories, what sectors do you think might align with your work? And would love to have you put responses in the chat as you think of, yeah, I need to branch out. I need to engage. What sectors, and as Charlene mentioned, which are the ones that you don't really think of off the top that need to be at the table. So I'd love to hear from you in the chat with that first answer. And then on a scale of 1 to 5, how confident are you in your ability to engage in projects that might involve multi-sectors? and hoping that this presentation gives you a boost of confidence, with 5 being you're confident in being able to do this work. I think we are at time. And again, really appreciate the time and attention that folks invested in this. To our community partners who presented, thank you so very much for representing the amazing work that's going on in public health in Idaho, and this work to build systems and build bridges between. So thank you. And I'm delighted to see that we've got some confidence in the room. And I think, as you see, we have some local experts that would be, that are here to guide and support you. And there is one last slide that I should have been showing, that is promoting our Baccalaureate of Science in Public Health, which is an online degree. If any of you are looking for future educational opportunities or continuing education, check out our BS in Public Health. That is the online version of that work. So thank you all. Dr. Banks, I don't know if you have anything that that you would like to share before we sign off.
I just want to say thank you. Thank you to everyone. This is a very, very engaging conversation. This webinar has been recorded and will be available shortly thereafter. And we've already gotten comments for requests for slides. I was like, I can't promise those. Those are maybe proprietary, to the presenters. But just definitely the recording will definitely be shared. And just thank you all for this. And just want to put in a plug for our next continuing education session. It's going to be on Tuesday, February 13th. Our very own Kurt Kettleson will be discussing topic of managing and communicating complex data through effective data visualization. And again, this is our first time launching this, you guys, and we just really appreciate all the engagement. And your work here today has just been able to make this a tremendous success. So thank you.
Desmond, if we're willing to share our slides, do we send them to Sarah and she gets them to you? Would that work?
That would be perfect.
Great.
That would be perfect. Absolutely.
Thank you, Kelly. Thank you,
Absolutely.
Katie. Thank you, Courtney. Thank you, Charlene.
Thank you, everyone. All right. Thanks again, y'all. And we'll see you next month. Take care. All right. Bye-bye.